At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Natural Solutions for Shoulder Pain on Wednesday, March 19th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, Dr. Tom here. It's a beautiful day in the neighborhood. Sun shines out and it makes you feel like it's warm until you get outside, but it's still beautiful. As long as the sun's out there, everything's cool and you feel good and, your endorphins get a little higher and, life's good. Well, life's good across the board, and we're going to make it kind of in a better way for you today because I'm going to give you some information. I've been asked repetitively over the last week or so what I think of Robert Kennedy and his position and the things that he's doing. And there's a lot of people freaking out to say, oh, he's going to take away this and he's going to take away that. Well, there's some things I hope he actually does imprint and take away. But that's, my opinion, as you all should have an opinion about everything. But to do that, you have to be informed. And my job is to inform you. One of the things I want you to know about and make sure that you're totally aware is this exposure, this pollution, the stuff that's going into your food and your environment. And so that's my job. My job is to make sure you have the information. And, it's very interesting. I think I've told you many times when I go overseas, I go to teach somewhere, like I'm at the end of March, I'll be teaching in Naples, Italy for 2 days. And when I go there, I can eat things there that are kind of marginal for me, and they don't affect me. Why is that? Well, one of the biggest reasons is that they have things that are put in them in this country when they're manufactured, when they're transported, but also when they're grown, the agricultural portion of generation of our food supply, which they don't do over there. So let's just talk about one thing. And as we go through over the next weeks and months, I'm going to give you more and more detail because these are things that you need to know about. Our food is loaded with genetically modified elements unless you're getting non-GMO organic foods. Now, that's a big bite, right? Even if you see the word organic, doesn't mean that your food is clean. You have to have both tags. One says non-GMO, that means it's not genetically modified, and the other one says it tells you it's organic. That means it's clean the way it's produced. But it also is dependent on where it's grown. But let's talk a little bit about this one piece of the puzzle, which everybody needs to know more about, and it's called glyphosate. And what is a glyphosate? Well, it's a pesticide, and it's extraordinarily heavy. So Roundup, we know the weed killer. Roundup crops get glyphosate through different manipulations and so forth, and it's made in some situations directly from glyphosate. And the thing that is that about 20% of our acreage has been directly sprayed, implemented with glyphosates. And it's not okay because it causes a problem. I'm going to give you a statistic. This goes way back. What I'm talking about way back. We're talking about 8 years ago, 9 years ago, 9 years ago. And the U.S., and this is a direct quote, by the way, the U.S. says that 130 pounds of Roundup, this extract, this manipulated piece of glyphosate, weed killer is sprayed on every square mile. 130 pounds on every square mile, with the most usage coming from our farm belt. Where's that? Iowa and Illinois and Indiana and so forth. So glyphosate, the active ingredient in Roundup, is the most used pesticide on U.S. agricultural crops. It's estimated that 287 million pounds were used back then. That was in 2016. Now, it's scary. Now, move that forward. Do you think they're using any less? Does it give you a reason to suspect that there may be things that are showing up in our health that are maybe somewhat related to this, particularly when Europe will not allow the importation, of much of our food into the EU? Well, I don't know about you, but my brain, being as naive as it is, says, yeah, that kind of makes sense to me, right? So, uh, glyphosate, the most widely used herbicide, is a topic of concern, regarding the impact on health, I would think. Now, the Environmental Protection Agency of the United States says that that word sticks in my mouth, right? Glyphosate is not likely to cause cancer in humans. Now, do you hear that, humans? But they do all the studies of your vaccines and everything else on animals. And they say, well, if it works for them, it works for you. But it does cause cancer in animals. Now, studies have found persistent damaging effects on the brain. I don't know about you, but I like mine. I keep trying to enhance it a little bit, associated with these stupid Roundup sprays and the glyphosates and so forth. So, Bob Kennedy has said that he is going to expose this craziness and show us why it shouldn't be used. Now, if you notice, interestingly, recently, Bayer, the big drug company, bought glyphosates from other people. And because, you all know who they are, and I'm not going to get into it today because I got to be careful what I'm going to say after this. But are they dangerous? So there's a set aside. There's a, taken away from. There was an under the table dealing here. I can't wait till Bob Kennedy starts exposing this across the board, but I want you to pay attention and I want you to make your own decisions. There's a book that I have mentioned a couple of times and it's worth reading. It's called Seeds of Deception, Genetically Engineered Foods. And it was written, some years ago by a guy named Jeffrey M. Smith. It's available on Amazon and every place else, but pick it up. And, if you're like me and you're in the car all the time, get the download and listen to it. But I think after you get through the first 100 pages, you're going to be a little irritated, a little tweaked, a little, something's not right here. And you have to make sure that you have all the data. Seeds of Deception. And there's another one by Linda Castillo called Seeds of Deception as well. But nevertheless, get in, read it, be informed, and then send me questions. I'm happy to, tell you what my personal opinion is. I will tell you what we've seen in the practice as a result of it. I'll show you what other websites you can go to really get a handle on these things. But it's up to you. Guess what? Nobody's going to do it for you. You have to make sure that you're informed and don't take one side of the story, put it all together. It's too many of us got duped over a period of several years, right? What does that mean? That means that we listened to one side of the puzzle and we didn't put all the pieces together. Kind of interesting. I was saying the other day to somebody, obviously I was raised Roman Catholic and Italian Roman Catholic, which is like the heavy punch. Well, here's the deal. Somebody was talking to me about this life for this guy by the name of Jesus of Nazareth. And I said, if you really want the story, you got to look at the what? You've got to look at the Greek scriptures. You got to look at the Byzantine scriptures. You got to look at the Akashic records. You have to look at the Hebrew records. You have to look at every different platform to really understand who this guy was and the impact it had. Same thing when it comes to foods. Same thing when it comes to the things that are happening around us. The vaccines that they tell you that are so good for you. You have to make sure that you get multiple viewpoints and then make your own decision. And if you know, in fact, that it's globally a problem, then I would encourage you to get involved. I would encourage you to let your voice be heard, but not just from a rant, not just from an emotional tantrum, but very specifically get involved in your school systems, get involved in your communities, get involved in writing your congressman. Don't let them do things that are going to affect your health. Okay, having said that, let's get into the program today. We're talking a little bit about your neck and shoulder pain. As a matter of fact, coming up at the Roselle Center, I think the program is March the 19th, another Wednesday evening, 6 p.m. It's going to be a beautiful night because spring is here. It's just a couple days before the first day of spring. We're going to be talking about natural solutions for that shoulder pain, that frozen shoulder, that hurt every time you go out to reach something. It doesn't go away. So let's show you how it can be fixed. And join us on the 19th at 6 p.m. Remember, all you have to do is go to rosellecare.com or drtomroselle.com and register for a seat. And if you have a seat and can't attend, remember to give us a call at 703-698-7117. Say, hey, I'm sorry I can't make it. That way we have, a seat for somebody else. But we're going to get into that a little bit today. So, when we're talking about shoulder pain, it's extremely common in our society, and people think that it's, what do you expect for your age? Well, here's the deal, and we're going to talk more about it on the live stream today, so make sure you join me immediately afterwards. Go to drtomroselle.com, click it, go to your social media sites that you're following me on, right? And we'll let you know as soon as we get to it. But here's the deal. Sure, it can be bursitis, it could be a tendonitis, it could be a rotator cuff tear, it could be degeneration. It's called arthritis. And, this adhesive capsulitis, frozen shoulder, well, that's only one form of a frozen shoulder. Frozen shoulders can come about because the muscles are not firing properly. One is apparently too tight, another one is not firing at all. And there's reasons for that. Did you know that you could have a shoulder problem and it's your opposite hip that's the issue? That's kind of interesting. That's a gait mechanism. That means, when you're walking, that type of gait, you're walking around, and when you walk, your right shoulder, your left hip work, your left knee and your, right elbow are working together. If you watch somebody on a treadmill, it's kind of an interesting phenomena that you get to see, because otherwise you kind of look like an automaton and you walk around like a robot. But the rotator cuff is, that inflammation, that irritation. It could be for several reasons. Now, remember, the shoulder is a bone. It's a capsule. It's, these cartilages, it's tendons, but they are directed to work because of the nerves that come from your neck. So you could have a problem with a nerve being irritated, overstretched, being pinched, and the shoulder suddenly is not going to perform the way it's supposed to. It's not going to, if you will, fire and lift and do what you want to do. And then you go and you try to, ladies, you reach around your back and try to hook up your bra. It ain't happening, right? It hurts. Or now you got to turn it all the way around the front. You got to hook it up the front and then wiggle it around the back. Guys, you can't get your hands up to button your collar. I think that's why more and more guys don't wear ties these days, is simply because it's not only, nobody wants to have a noose around your neck, but nevertheless, it's difficult to button that up if your shoulders aren't working. Try to lift your arm above, try to get your arm back to put a coat on. The pain, the sudden pain that you get is telling you one thing: something is wrong. So we could have, when you see all the things like, well, you have arthritis, it started someplace, and it wasn't just suddenly that somebody touched your shoulder and gave you arthritis. It was been coming on for a period of time. It's, the adhesive capsulitis. Adhesive means it's stuck like glue. Capsulitis means the capsule within the joint space. But why did it happen? Was there an injury that was not resolved properly? Did you hit it? Remember, I've said repetitively that your body remembers problems. That, let's say when you were a kid, somebody smacked you, or you fell down, playing soccer or playing football, or you got hit in the shoulder with something, and it really stung. It was really bad, and it swelled up for a while. And you had a strain, you had a sprain, you had, it's torn, but it'll heal up. But it was never fully functional. Now, there's ways of distinguishing things, little things. It's like if you move your arm on your own and you say, ouch, it hurts, that's called a tendonitis if you get hurt suddenly. If you have somebody else move your arm and it doesn't hurt, but it only hurts, uh, when you have that, you moving it, that's a tendonitis. Now, if it hurts in any condition, whether somebody moves it or you move it, that's a bursitis. That bursa is like a sponge that's between the tendons and the muscles, and it's swollen, it's irritated, something happened to it. But if you leave it alone, what happens is calcium begins to infiltrate into the system. And when it does that, now you got a calcific tendonitis or a calcific bursitis. Why is the calcium going in there, you should ask? So I'll give you the answer. The calcium goes into it because it tries to neutralize the what? The swelling, the inflammation, because it's acidic, it's eating things up. So body tries to buffer it, but it doesn't know when to stop. But we're going to go on over the next couple of weeks and we're going to talk about what happens in this craziness of shoulder pain. But more importantly, to get you to understand that if you act and do something about it, you can fix it so that those tears don't continue to get worse. The arthritis doesn't cause continued degenerative changes where now your doctor's talking to you about a shoulder replacement. Now, that's not okay, right? Because now you got sometimes they reverse the position of the shoulder and they do all kinds of weird stuff today, but I'm going to show you what those weird things are when we meet. And by the way, on that day, on the day that we're going to do the presentation in the Roselle Center here, Dr. Harlan Browning, the professor, is going to be with me. And he and I are going to go through this and we're going to talk about this shoulder problem, but more importantly, what you can do about it, but also, can it be rehabilitated fully and completely to a place where you have good function and you don't have to worry about it? How about, you used to like to play tennis, right? Or you thought this pickleball game that's out there was a great thing to try, but your shoulders hurt and it just leaves it worse afterwards. Well, I want you to be able to do whatever you want to do. And if you understand the mechanics, and it's not just injecting it with a steroid, it's not giving you an anti-inflammatory, and then see if during that period of time you go get some rehab, which doesn't work. And by the way, I'm going to use an expression that I learned from a colleague of mine that, when you do rehab exercise, you go to the gym, they have a religion of 10. Excuse the cut there, but what it means is that they're going to do everything 10 times. Sometimes your shoulder can only work, or any muscle can only work 3 times or twice. So it doesn't mean that you do twice and go home. It means you do twice, you give it a break for a few minutes, you do 2 more, you give it a break for a few minutes, you do another 1, and you learn how to increase the ability of that muscle to go 2, 3, 4, 5. Maybe at some points you get it up to 10. But if you go 10 right away, even at the very lowest weight, you may be causing more irritation, more inflammatory response, and it never heals. It just continues to micro tear, where now you've got a chronic condition that just always is with you. So we're going to cover that, by the way, on the 19th. We're going to show you what to do, but more importantly, we're going to show you the fix. We're going to show you what can be done. So make sure you register for the class. Go to rosellecare.com, register, scroll down. You're going to see Ageless Health Education Classes, and register. Natural Solutions for Shoulder Pain. And we're going to get into it, and we're going to show you exactly what you can do. But undiagnosed problems over a period of time when it comes to shoulder can really trigger more and more discomfort and more damage and more permanency over time. So you've heard the thing that slap tear, right? Well, that's just that cartilage that's inside of that makes a little foundation for the shoulder to sit into. What causes that? It's usually muscles that are not firing the way it's supposed to. You could have a little bit of a tear in what's called the retinaculum. That's the fascial sheath that holds the muscle tight against the bone. And you have to be able to heal that. You have muscles that are pulling in opposition to each other, one too much and one not enough. By the way, you could have an ongoing heart problem. You could have heart pain, and it could be causing that shoulder not to to do as well as it should. Why? Because remember my world, organ-muscle relationships? Well, there's a muscle that's right behind the shoulder blade, or in front of the shoulder blade, I should say, and it's called the subscapularis muscle, and it relates directly to the heart. So you have that, remember that organ-muscle communication. The nerve comes out, part of it goes to organ system, part of it goes to a muscle. So if the heart's not working, there's too much stress on the heart, or you've had these little many vascular problems that have occurred with the heart, then you could have a problem with shoulder pain. And you have to be able to test it specifically. In our world, when somebody comes in, with any kind of shoulder pain, we're testing a ton of muscles. We want to see exactly what the condition is. But if that muscle shows up, and then I look at your tongue, and you got a little reddish tip of your tongue, I check your acupuncture pulses out, and the heart channel is not working the way it's supposed to. I check the upper part of your back at thoracic 1 and 2, and you have a problem with the positioning of those vertebrae. I may be sending you out to the cardio guy and have him take a look at you. Not cardio going to work you out, the cardiologist who's going to do another step up. You may have a problem in your neck. There may be an old injury that sits there. Your clavicle, that shoulder, that little bone that sits at the top of your chest, may be out of position, maybe overstretching its attachment or its insertional pattern. The shoulder blade and the clavicle come together, and that AC joint, that acromioclavicular joint, may be stretched just enough that's not allowing the shoulder to work, and it hurts. It hurts like crazy. So any of those things are possible. You could have a lung problem causing you that. You could have a liver problem causing you shoulder pain. Yep, because all those muscles relate to those different organ systems. And on the 19th, we're going to get into it in depth. We're going to show you exactly what it looks like. So you'll be really surprised, all the interconnected pieces. And if you really get it, you really understand it, and you look at it from a structural, chemical, and a decision, emotional platform, you can resolve virtually anything, but you can't ignore it. You can't just say, oh, it'll go away. It'll freeze up and it won't bother me. Yeah, it'll freeze up all right to the point that you have a frozen shoulder and you can't do anything about it. It's like, really? Listen, we're coming up to the end of the program. Follow me on live stream. Remember, I'm here for one reason. I love you all. Let's go. I'll see you in a couple seconds.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Neuromuscular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live. If you're in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Natural Solutions for Shoulder Pain on Wednesday, March 19th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.